The MP condemned what he deemed a failed system and urged government to match their rhetoric with actions. According to Anthony, in the 3 years since the Apnu AFC coalition government took office, drug shortages at Guyana's medical institutions, coupled with several other pressing matters, has become a norm.
In just 3 years, there are clear signals or signs of failure in the public health sector. Anyone who has recently utilized the system can attest to its failings. Long waiting times at outpatient clinics, longer waiting times for surgery, unavailability of diagnostic tests, constant shortages of drugs have plagued the system. And Mr. Speaker, as if this is not enough, admission to the GPHC now is like a lottery. Patients have to hope that when they get sick and go there, that there's a bed that is available. In some cases, people have to wait in the accident and emergency for days on end to get a bed up in the ward.
Further, Dr. Anthony argued that government, in its bid to keep Guyanese blinded, recently announced that a shortage of tuberculosis drugs has since been rectified, but however failed to explain how such a shortage came about in the first place.
The Honorable Minister Jordan, speaking on tuberculosis, pointed out an increase in the incidence of multi-drug resistant strain of the disease. Yesterday, Minister Cummins confirmed multiple drug resistance. But what she did not tell us, or what she did not explain to us, was the reason why we have multiple drug resistance TB in Guyana. Mr. Speaker, the experts would tell you that multi-drug resistance TB developed because of program failures, because they have been stuck out of critical drugs, inadequate monitoring, poor compliance, and sometimes patient poverty.
Government, in a statement after procuring the drugs, had blamed the shortage on a delay, revealing that the said drugs are sourced from South Korea, Japan, India, and Cyprus through the Global Drug Facility. Meanwhile, touching on the recently observed World AIDS Day, Dr. Anthony posited that under the People's Progressive Party Civic, tremendous strides have been made in Guyana to fight the said illness. He, however, argued that currently government is failing to implement effective ways of fighting the disease in Guyana.
We note that the disease is on the increase in certain age group. Mr. Speaker, the adult prevalence rate is 1.7%. And when we look at the high-risk groups, it's even higher. So, for example, among sex workers, it's 6.1%. Among transgender people, 8.4%. For high-risk population groups, one of the most effective ways of preventing this disease is for us to introduce prevention exposure prophylaxis. I urge the government...
Remember, you have 2 minutes remaining.
Thank you, Mr. Speaker. I urge the government to urgently implement this most effective way of preventing this disease in the country.
Further, it was revealed that some 60,000 Guyanese are diabetic patients, an illness which could be helped with the aid of a glucometer. As such, Dr. Anthony noted that monies wasted on the Sussex Street bond could have procured some 65,000 glucometers. Amidst loud heckling, Anthony continued his lambasting and noted that suicide has since taken a back burner in Guyana, as mental health workers at this time are lacking even transportation in order to assist patients. Reporting for the Evening News, Kizzy Coleman.